Distribution of the drug. This is a parameter of the pharmacokinetics, as we already know, and it takes place after the absorption of the drug. So what happens, the drug, if taken orally, is absorbed in the systemic circulation, and from here it has to be distributed to different tissues. Now we have to monitor this distribution because we have to know about the plasma concentration, how much amount of drug is there in the systemic circulation, after that how much is going to the target tissue. For that all things we have to know about the distribution. So if I directly talk about the original distribution of the drug, that is dependent on a lot of factors, and it is not feasible practically to talk about the distribution itself. But still, if I talk about the original distribution of the drug in the from the systemic circulation to the tissue, it depends a lot on a lot of factors like iron solubility. So it will be depending on the iron solubility. Then ionization of the drug, whether the drug is ionized or unionized. If it is unionized, it will be crossing the biomembranes, otherwise it won't be. Then extent of binding to the plasma protein bound form. So whether it is bound to the proteins of the plasma, then it won't be distributed, otherwise it will be distributed to the tissues. Then whether it is having the specific tissue transporters. So tissue transporters are available or not. Some tissues require certain transporters to let the drug enter inside. Then regional blood flow. So that also become a limiting factor. Regional blood flow also becomes a limiting factor because some regions allow easy movement of the blood because it is well perfused, and some do not allow that much movement of the drug because that is having less blood supply. So these all factors are limiting the exact distribution. For that purpose, to practically know the different values, we have devised a specific hypothetical term. So volume of distribution, this is another hypothetical term which we have devised, and this is nothing but it is the amount of administered dose when we consider the body as a single compartment. Suppose this is the systemic circulation and it is just a compartment in which we are administering the drug, and that will be immediately, yes, remember, immediately and quickly it will be distributed uniformly in every part of the body. So the volume of distribution is nothing but it is that volume that would be required to contain the administered dose which we are giving IV. If that dose was evenly distributed at the concentration measured in plasma, if more amount of drug is entering the tissue, it has a higher volume of distribution and vice versa. That means if the VD is high for something, then it will be distributing more amount of drug to the tissue. So volume of distribution is nothing but it is a hypothetical term which tells us how much amount of drug is being given to the tissues and how much is contained in the plasma protein bound form. I'll explain it again. If we want to calculate the volume of distribution, then it will be IV dose, if we are giving some dose of certain drug through IV, divided by plasma concentration. So that's how we can calculate the volume of distribution. So it can be calculated by dividing the plasma concentration attained to the dose of a drug administered through IV route. So initial plasma concentration, it is very easy to calculate by using the AUC or by extrapolating the graph of plasma concentration with time. Now there is another thing, whatever plasma concentration is there, they will be keep on eliminated by the kidney also. So excretion will also be there. So we have to keep that also in mind. For that, for the ease of all those effects, the volume of distribution has been devised. Now this volume of distribution depends on two factors. One is the lipid solubility and second is the plasma protein bind. What does that mean? If the drug is unionized and it is lipid soluble, it will be more easily distributed to the tissues. And when the plasma protein binding, if it is more, there are certain, suppose this is the blood vessel and in this there are certain plasma proteins. Now these proteins, if we are giving a drug, this protein will bind this drug with them and won't allow this drug to pass through the blood vessels. the pores of the capillaries basically. So what will happen? They will restrict the blood in the drug in the compartment, and this particular thing is known as the plasma protein binding. So more the plasma protein binding, less will be the volume of distribution. Now summarizing volume of distribution in one line. So volume of distribution is nothing but it is the amount of the blood which can be transferred to the tissue through the systemic circulation. So volume of distribution will be high if the distribution is more, and it will be low if the distribution is less. Then that again depends on two things. One is the lipid solubility and then the plasma protein binding. Let me explain it again. Suppose this is the blood vessel and having the systemic circulation, and this is the tissue of our interest where we want to put this drug. So what happens? There will be certain plasma proteins inside this vessel, and the drug which we are giving, suppose I can denote it with D, they bind this drug with them. Now what happens if the volume of distribution is low, or volume of distribution is low and plasma protein binding is high, then only little amount of drug can go to the tissues. Suppose if we are putting 100% of drug inside and the plasma protein binding is 95% and we have 5% of the drug to be free, so here we will be having 5% of the drug which is free. Now this will be given to the tissue. The important thing about this free drug, this is the only fraction of the drug which will be undergoing metabolism also. So the drug which is free of the plasma proteins, that will be undergoing metabolism, that will be doing the therapeutic uses also. So let's discuss this. The lipid solubility, if we already know that this is the unionized part, this is the unionized part which will be crossing the biomembranes. So blood vessels will be, here are biomembrane of the interest and they will be crossing towards the tissue and hence will give the high volume of distribution. So that means volume of distribution is directly proportional to the lipid solubility of the drug, and this is the concept you have to remember while solving the questions. Then comes the plasma protein binding. If there is high plasma protein binding, less fraction of the drug will be free to go inside the tissue as well as go metabolism. So it will be inversely proportional to the drug which reaches the tissue, that means the volume of distribution. So we have to remember only these two concepts to clear all the conceptual question which can come on the basis of distribution. So now there are drugs which are having very high plasma protein binding, and these drugs are warfarin, benzodiazepine, furosemide, CCB and digitoxin, that I will be explaining through a mnemonic in the next slides. Now as it will be behaving like a large molecule, why it is not the plasma protein binding when it is done? So there will be certain proteins in the plasma which will be binding the drugs. Now these proteins are not able, they are large enough that they are not able to cross the biomembrane. That's the reason they are not crossing. So it will be behaving like a large molecule and more likely to stay in the plasma, that is the blood compartment. Many times terminology that is known as the plasma compartment or blood compartment is used for this. So these will be remaining inside the blood compartment. The free form which will be free, that will be only undergoing the metabolism of the drug, as I have already explained. Therefore plasma protein binding makes a drug long acting. Why it is? Now we can have our third concept. Plasma protein binding is inversely proportional to the metabolism of drug. Less the metabolism of drug or delayed the metabolism of drug, more will be the duration of action. So long acting drugs are also those drugs which are having plasma protein binding in the increased form. So more plasma protein binding means more duration of the drugs. Now certain drugs can be removed by dialysis. As we know, there are certain drugs which can be removed by dialysis, but if the drugs are bound to plasma protein, they will be remaining, they won't be able to cross the small fenestration of the nephrons. That's why they will remain inside the body. That may cause the toxicity of that drug also. So therefore drugs having high plasma protein binding like diazepam cannot be removed by dialysis. We have a mnemonic for remembering the drugs which are having high plasma protein binding. We can remember these drugs as vitamin B, fights war for longer. If you are eating the vitamins, the nutritious food, that is the vitamin B and C, so you can fight war for longer, or we can say the nutrients like vitamin B, C fights war for longer. The reason to repeat these things again and again is to incorporate into yourself that this mnemonic will be for the longer acting drugs. That means having high plasma protein binding drugs. So V here stands for verapamil, imipramine, T tolbutamide. Then comes the benzodiazepines, that is diazepam, chlordiazepoxide and midazolam. Then comes the C chloropamide. Then fight. Here we'll take the first word, the capital word always is taken for the mnemonic here. So in mnemonics we'll be taking only the capital words for mnemonics. So F here is for the fluoxetine. Then W here is for warfarin, and longer means longer acting drugs due to high plasma protein binding. So it will become easier for you to remember these drugs through this mnemonic. Now we have another mnemonic for the drugs which are not effective, in which the dialysis is not effective. As I told that the dialysis is not feasible in drugs with high plasma protein binding. I gave the example also. So we have certain example for this. We can remember avoid dialysis. In these drugs we should avoid the dialysis. Here A stands for amphetamine, V for verapamil, O for organophosphates as well as opioids drugs, I imipramine, D digitalis, and dialysis diazepam. Diazepam I already discussed earlier also. So this is the mnemonic for remembering those drugs which are having high plasma protein binding, and in these drugs we should avoid the dialysis. Now there are certain clinical importance of the plasma protein binding which I have discussed. So there are 4 clinical importance we can remember by 4 Ds, 4 capital Ds. So first D says that the plasma protein binding gives you the duration of action. So duration of action, if the drug is having high ppb, then it will be having more duration of action. Then it gives you the distribution, that means higher the ppb, less will be the distribution or less will be the VD. Then displacement, this is an interesting thing. If you are putting, if a drug has acquired a plasma protein, suppose this is the D drug and it has acquired a plasma protein, then a drug with higher plasma protein binding capacity than this particular drug, suppose this is D and another drug comes, that is D1, it comes here, it will, and it is having more plasma protein binding than this D, then it will displace this particular drug and it will bind to it. So what will happen, what does that mean? Highly PPP drug can be displaced by another highly bound drugs. So drugs which are having higher PPB will be given preference by the proteins. So the fourth is the dialysis, and as I have already discussed, it is not effective for the drugs having high ppb, so we cannot do dialysis in those drugs. So certain important facts and concept of the for the VD which can come in exam. So VD of a drug, if it is low, so it will be having high plasma concentration and more drug will be present in the plasma in the bound form with the protein. So there will be more drug inside the intravascular compartment or in the blood vessel, I can say. Now if the VD of the drug is high, there will be less plasma concentration, that means there will be less drug in the systemic circulation or intravascular compartment, so more drug will be entering the tissue and gets deposited inside the tissue. So VD is nothing but it is the indicator of the extent of tissue penetration by that particular drug. So more the VD, more is tissue penetration. Now if VD is more, that means more amount of drug is in the tissue and less in the plasma. Thus higher dose, if we want to make a particular therapeutic concentration inside the our compartment, suppose let's see, if we have this compartment, vascular compartment for us, and we are having a drug with plasma concentration, say X. Now if we want to maintain this particular plasma concentration and the VD of drug is very high, then it will be keep going inside the tissue, will be leaving the compartment again and again and will go to the tissue. So what will happen here, the plasma concentration will fall, and to increase that plasma concentration we have to load this particular compartment with more and more drug. So we will be loading too much drug inside it so that we can maintain a particular plasma concentration which is needed for the therapeutic use of that particular drug. So this dose which we are giving in a load form, in a too much amount, it is particularly known as loading dose. So what is loading dose? This is the higher dose which has to be administered to attain the same plasma concentration for drugs having high VD than those having low VD. So this is high dose is known as loading dose. Thus VD is the main determinant of the loading dose. So question can be asked, which determines the loading dose? VD will be determining the loading dose. Now chloroquine, again a very important question for exam. Which drug has the highest VD, that is 1300 liter per kg, and that is chloroquine. So this drug will be having the highest VD. So low VD, if the low VD is there, then there will be increased plasma protein binding, as we have discussed. Less drug will be available, free drug will be available for metabolism, so less will be the metabolism, and hence the drug will remain inside the body for longer time and it will be excreted later. If PPB is high, plasma protein binding is high, then high incidence of drug interaction will be there, because unbound drugs which are present inside the vascular compartment and not leaving the compartment may cause toxicity inside the body. So let's discuss certain questions based on the distribution. The first question here is, dialysis is ineffective in all of the following except. So here dialysis is the keyword for us and they ask the wrong statement. Okay, we have to remember except always. So there are certain drugs in which we should avoid the dialysis, right? So this is a mnemonic. So A here stands for amphetamines, V for verapamil, O for organophosphates and opioids also, I for imipramine, D for digitalis, and last but not the least dialysis, that means for diazepam. So let's try to find. Amphetamine is there, yes, that's there, so this will be the correct option. Then comes the verapamil, verapamil is also there, and then comes the organophosphates. These all are ineffective, so we have to avoid the dialysis in all these three. So answer to this question will be none of the above. So the question here says, all of the following factors tend to increase the volume of distribution of a drug except. Now it is asking about the factors which can increase the volume of distribution, which is our keyword here, but it is asking for the except. That means we have to find the factor which decreases the volume of distribution. So let's start with the D option. Or before that, I must tell you, VD is directly proportional to the lipid solubility and inversely proportional to plasma protein binding. Okay, so let's see if it is having high tissue binding. That means it will be more going towards the tissue. So here VD will be higher. Why? Because more drug will be going towards the tissue. Then high lipid solubility. If lipid solubility is high, then volume of distribution will also be high. Then low ionization at physiological pH values. That means it is having low ionization. That means more unionized drug is there, which will be more lipid soluble and we can find from here, more the lipid solubility, more will be the VD. Now let's see the first option, high plasma protein binding. As we know, VD is directly inversely proportional to ppb. So higher the plasma protein binding, lesser will be the VD. So answer to this question should be A.